I quit coffee.
Did you?
I did.
Why?
I quit. I just it was just too intense, too aggro.
Oh.
Yeah.
Really?
Yeah.
How do you poop in the morning without drinking coffee?
So let's just take a look at these high-level athletes. So these high-level athletes, they're playing, and this happens.
Oh my god.
That was not keeping it high and tight.
God.
His name is Tom Segura. Segura, that's right, that's right. Wait, is he Japanese? I think he deserves an Academy Award. He literally made it seem like he had a knee injury and a broken arm in one flop.
I think that was real.
Wait, he wasn't faking it? That wasn't acting?
He's not that good of an actor.
Acting.
Yeah.
Brilliant. Well, let's just rewind it. Let's take it from scratch. So he ended up with a fractured humerus, a broken arm. What's a fractured humerus? All right, we're not going to break this. This is the only one I have. Okay, no contact.
You're so slow.
So what did he do? So he actually fractured his humerus shaft. It's in the area of the distal third, middle third junction. Now, what does that mean? Now, unfortunately, some of the muscles come off here, but you can't see what's coming along here. And everyone's been chattering about, oh, this and that, but what is important here? This type of fracture, especially shaft fractures, little bit of comminution. It's mostly a transverse fracture, which is a good thing and a bad thing, okay? I'll get into that later. Everything is good, bad, and ugly, right? So the radial nerve comes right along here and passes through a groove right adjacent to the fascia overlying the humerus bone. And so in its worst situation, the fracture bruises, contuses, and unlikely severs the nerve. That typically happens in puncture or severe gunshot or severe open crush type injuries. When you break the bone, you snap it, and then it just flops the radial nerve all over the place. And sometimes what happens is, say the bone is here, the bone can flip and then land over here. And so it could be interposed within the fracture itself. So I don't know the full extent of his neurovascular status. Apparently he was wearing a glove for some for neurologic injury. I don't think he had a vascular injury, but he had some degree of dysfunction of the nerve. Most often with this type of fracture, you get a radial nerve palsy. That means a wrist drop, okay, for the most part. I mean, it's essentially the radial nerve supplies the extensors and the wrist extensors and some of the forearm muscles on the extensor side. So you end up with a little bit of a wrist drop. And so that is certainly possible. Now, there was some chatter that maybe his friend caused it to become worse or something or the other. He's a good Samaritan trying to help out. Maybe he did it too much. Maybe he did it too far. I'm not going to judge that. If you leave an arm in a twisted manner for too long, that can cause contusion and pain and instability and discomfort. So what he should have done, actually, if he knew, is to actually apply traction. So say Bert were to hold his arm here and his friend were to hold it here, and you applied, not applaud, you could applaud, but applied traction. So you're pulling on the arm, it's distracting the bones, keeping the myofascial integumentary system in traction, so that hollowness that the fracture creates when it breaks has space. And then with traction, you line it up into as neutral, normal position as you can. Let's look at that again. Yeah, he didn't apply traction, but he was a good Samaritan. So don't be hard on him, all right? He was a friend helping out a friend, and I don't think he necessarily may or may not have caused anything to become worse. The fracture did. More than likely, when the fracture snapped, the radial nerves contused, that, you can see it. I mean, it was a spectacular fall. I mean, typically you see those kind of spectacular falls in high level. No, you don't. That was a belly flop. Well, no, it wasn't really a belly flop. It was a back flop on his arm with the knees bent in the most awkward position I've ever seen. It was pretty entertaining, but let's get serious. He did injure himself. So, and I've treated a lot of these commonly. I mean, having a humerus fracture with a radial nerve palsy in and of itself is not common, but I do a lot of shoulder upper extremity work. And in that area with trauma, you see a lot, whether it was at Stanford Trauma at a high level center or at a community trauma facility. I've seen a lot of humerus fractures, and a small percentage of them are fractures which have a radial nerve palsy. So when you see a fracture like this, it's not just about lining it up and taking care of the bone, because if there's a radial nerve palsy, you know you have to understand where that nerve is and where it could be, and that can affect how you treat it. So again, I didn't treat this fracture. You can see the x-rays, they're posted on Twitter. So he went from fracture to open reduction internal fixation. What that means is you open up the fracture site, put plates and screws on to stabilize it. Now, the plates, he's got two plates. He's got one large anterior anterolateral plate and one lateral plate. Now, why did he use two plates? I think that's a question for the orthopedic surgeon. Humerus fractures, based on the large, broad DC plate that I see in there, doesn't necessarily need an additional plate. However, if there was additional comminution, maybe a butterfly fragment or instability, there could be a multitude of reasons that an additional plate was required, and no one here is to judge. The only person that can judge that is the operating surgeon who is in there looking at the fracture and treating that wound. So in the end, the approach for the humerus, you don't want to go straight at the radial nerve, right? You want to be able to go in a manner that's safe with neurovascular structures. So what do? You go in anterolaterally. You go into the bone and you peel away all the tissues. You get right down to the bone. First thing you do, what's the first thing you do? Find the radial nerve. Exactly. You find it, you protect it, you expose. Sometimes you have to go above and below the fracture site. Make sure you have identified the nerve, and then you stabilize the fracture. They had to go all the way down to the area of the elbow. You want at least a stable construct below and above the fracture site. Now, typically, for a medium-sized bone, you want at least 6 to 8 cortices above and below, okay? Now in the broad DC plate that he used, you could get away with 6, but he may have had additional comminution. You could see there's some subtle fracture lines, so that may have required him to go put an extra few screws in, maybe some butterfly fragments, which are extra little pieces that kind of fit in like a jigsaw puzzle. Remember that? Jigsaw puzzles? You never thought it'd be useful knowing how to do a jigsaw puzzle until you get to trauma. There you go. So putting it back together, putting the plate on, additional plate as needed, and then what do? You lay the radial nerve back over where it's supposed to go. Now that could mean that it's sitting on top of the plate. It's possible. But the most important aspect is protect and preserve neurovascular structure. Then you treat the bone, you stabilize the bone, recheck your neurovascular structures, and then you can close. What's his long-term prognosis? Short-term, he's going to heal. Why did he break it? That's a good question. It's a pretty bad fall. He's a big guy. He landed with an awkward arm, like boom. And so just that mechanism is there. Now, could there be other medical comorbidities that he has? It's possible. There could be, a lot of things can lead to poor bone quality, diabetes, thyroid, high blood pressure, obesity, certain medications, drugs, endocrinopathies, all sorts of different things. We're not going to get into that because that is HIPAA secure. Now, would LeBron James have broken his arm or his knee from a fall like that? He wouldn't have fallen like that. Okay? So first of all, there's no way LeBron would have fallen like that. So very, very different athletes, okay? But that is basically the humerus in a nutshell. And the humerus itself takes anywhere from 8 to 12 weeks to heal. While it's healing, because you fixed it and stabilized it, and now, and this could be a good rationale for the two-plate construct, early aggressive range of motion and rehabilitation, because he's got a radial nerve palsy, you want it to work. And I've seen patients that their radial nerve recovered very quickly, but then most often these radial nerves can take anywhere from up to 6 months or longer to fully recover. That sucks. It's like a millimeter a day. It just kind of keeps creeping along, getting better, because you have a bruise and then it gradually recovers. So don't be surprised if you have to have some sort of a wrist drop splint and recovery and PT and OT and hand therapy for some time. But then if it comes back quite quickly. It's remarkable, especially if it's just a bruised, contused radial nerve. Radial nerve is such that you just look at it funny and it stops working. So I'm not surprised that this fracture caused some type of a palsy. It's just notorious for that. And so if you look at the bone healing, then the muscular soft tissue healing, then the nerve recovery, it'll be a good process and for about a year, I would say. And at the best, he's going to be playing basketball at 6 months. At the worst, it'll be a year. And by playing basketball, I'm using air quotes. So, and we're not even going to get into this patellar tendon and knee injury because this was so exciting. But he'll recover. Tom, you're going to be fine. Don't worry, mommies. He'll be okay.